All right, so get ready, because today we're taking a deep dive into a topic that might surprise you.
Oh, really?
Yeah, you might be surprised to learn that the most common bacterial STD in the U.S. is, well, chlamydia. I know, not exactly, the most glamorous
Yeah,
subject,
right.
but trust me, it's way more widespread than most people realize, and we're going to be breaking down all the need-to-know info based on the latest CDC guidelines. To help us really understand the significance of all these details, we have an expert here with us to break it all down. What's really fascinating about chlamydia is that despite all the sexual health conversations happening, there are still a ton of misconceptions floating around. And people just don't really grasp the long-term consequences if it goes untreated.
That's absolutely right. And one of the most shocking things is just how prevalent chlamydia is. It affects roughly 1 in 20 sexually active young people. That's a staggering number.
Wow, 1 in 20. That really puts it into perspective. I think a lot of people just assume that, STDs are less common than they actually are.
Exactly. And while it's true that young people under 25 have the highest rates of infection, that doesn't mean those over 25 are, off the hook.
Yeah.
Anyone who is sexually active can get chlamydia, especially if they have, new or multiple partners.
So it's definitely not just a young person's problem, so to speak. And this is where it gets even trickier. You mentioned misconceptions earlier, and I think one of the biggest ones is that you always know if you have an STD. But with chlamydia, that's often not the case, is it?
You're hitting on a very crucial point. The fact that chlamydia is frequently asymptomatic is one of the main reasons it spreads so easily. People can have it and pass it on without even realizing it.
That's a little scary, to be honest. It almost feels like a silent threat to your health. So let's talk about why it's so important to catch it early. What happens if chlamydia goes untreated?
Well, that's where the potential for long-term complications comes in. And for women, it can be particularly serious. Untreated chlamydia can lead to pelvic inflammatory disease, or PID, which is an infection of the reproductive organs. It can be incredibly painful.
Yeah.
And even cause scarring in the fallopian tubes.
Ouch, that sounds awful.
It really is.
Yeah.
And that scarring can increase the risk of ectopic pregnancy, which is when a fertilized egg implants outside the uterus. And that's a life-threatening condition. Chlamydia can also contribute to infertility.
So early detection is really key here to avoid those complications. But how do you know if you need to get tested?
The CDC recommends annual chlamydia screening for all sexually active women under 25. For women over 25, it's recommended if they have certain risk factors, like new or multiple partners, or a partner who has other partners, or a known STD.
That makes sense considering the higher prevalence in younger women and the fact that people might not even know they have it. It sounds like open communication about sexual history is super important.
It absolutely is. And honestly, it should be a part of any healthy relationship. The good news is that we have very effective ways to screen for chlamydia. Studies have shown that screening programs can actually reduce rates of PID. So we know they work.
That's reassuring. So what's involved in the screening process? What kind of test is used?
The gold standard for diagnosis is a test called a NAAT, which stands for Nucleic Acid Amplification Test. You know how you can give a urine sample for a pregnancy test? It's similar for chlamydia. It's quick, easy, and non-invasive. The NAAT test is incredibly sensitive and can detect chlamydia in urine, vaginal swabs, or even rectal and throat swabs if needed.
Wait, rectal and throat swabs? I didn't realize they could test for it in those areas.
Yeah, it can be a little surprising.
Right.
But those tests are important for people who engage in anal or oral sex, as chlamydia can infect those areas too. And get this, home collection kits are becoming more available, which makes getting tested even easier and more private.
That's fantastic. It really empowers people to take control over their health. So we've talked about who should get screened and the testing process. Let's get to the big question everyone is probably wondering. What happens if you test positive?
Well, the good news is chlamydia is highly treatable with antibiotics. It's not something you want to ignore, but if you catch it early, it's very manageable.
That's definitely reassuring to hear. So what's the usual course of treatment?
The most commonly recommended antibiotic is doxycycline, and you take it twice a day for 7 days. I know some people have heard about azithromycin, which is a single dose, and it's been a popular choice because of its convenience. However, recent research has pointed out some potential advantages of doxycycline. Studies have shown that it's actually more effective in treating rectal chlamydia infection.
So even though azithromycin works well for urogenital chlamydia in women, it might not be as reliable for rectal infections.
That's right. And what many people don't realize is that rectal chlamydia is actually quite common, even without symptoms or a history of receptive anal sex. And if it's not treated properly, It can increase the risk of transmission and even lead to repeat urogenital infections through what we call autoinoculation.
Okay, I'm going to need you to break down autoinoculation for me. That sounds a little intimidating.
Imagine you touch an infected area and then touch your genitals. You're essentially reinfecting yourself. It's like accidentally spreading the bacteria to another site.
Ah, got it. That makes sense. So doxycycline seems like the more comprehensive choice in this case.
It does. Plus, there's another benefit to doxycycline. It comes in a delayed-release 200-milligram tablet, which means you only have to take it once a day for 7 days. That could be more convenient for some people. And as a bonus, it tends to have fewer stomach upset side effects than the twice-daily 100-milligram dose.
Okay, so it's easier to take and gentler on the stomach. That's a win-win. Of course, it's always important to talk to your doctor about the best treatment option for you. But no matter which antibiotic you are prescribed, I imagine it's super important to finish the entire course, right? Even if you start feeling better.
Absolutely. You want to make sure the infection is completely cleared. And stopping early can actually contribute to antibiotic resistance. That means the bacteria could become stronger and harder to treat in the future.
Right.
Not just for you, but for everyone.
That makes perfect sense. Okay, so we've covered testing and treatment for the individual, but what about their partners? You mentioned earlier that notifying and treating partners is crucial to preventing reinfection and further spread. But honestly, that can feel like a really awkward and difficult conversation to have. What advice would you give someone who's struggling with that?
I understand completely. It's a sensitive topic, and there's definitely a stigma associated with STDs, which makes it even tougher. The most important thing is to approach the conversation with honesty and respect. Remember that your partner deserves to know, so they can take care of their own health. And you're not alone in this situation. Many people find themselves in this situation. And there are resources available to help you navigate those conversations. If you're feeling overwhelmed, a healthcare provider can offer guidance and support.
That's really helpful advice. It's important to remember that open communication is key in any relationship, especially when it comes to sexual health. Now, circling back to screening, we've established it's incredibly important, but are there any downsides or potential risks associated with chlamydia screening that people should be aware of?
That's a great question. And it's important to be aware of both the benefits and the limitations of any medical procedure. One concern some people have is the possibility of false positive results. That means the test indicates an infection when there isn't one. That can lead to unnecessary treatment and anxiety. However, the tests we use for chlamydia, particularly NAATs, are very accurate. The benefits of catching and treating chlamydia early generally outweigh the risk of a false positive.
That's reassuring to know. Are there any other considerations when it comes to screening?
Well, there are practical aspects like cost and accessibility. Chlamydia screening may not be covered by all insurance plans or available in all healthcare settings. And some people might find the sample collection process a bit uncomfortable, especially if swabs are involved.
Right. It's good to acknowledge those real-world factors. But it sounds like in the big picture, the benefits of getting screened definitely outweigh those potential drawbacks.
I agree. The consequences of leaving chlamydia untreated can be serious. And early detection and treatment is the best way to protect yourself and your partners. It's all about taking a proactive approach to your health.
I love that taking control of your health is such an important message. And on that note, we're going to move on to the final part of this deep dive, where we'll explore the cutting-edge research and exciting developments happening in the world of chlamydia prevention and management. Welcome back to our deep dive on chlamydia. We've covered a lot of ground, from how common it is to screening, treatment, and talking to partners. But now let's look ahead. What's on the horizon for chlamydia prevention? I know there's some really interesting research happening.
There is. It's a very exciting time to be working in this field. One area that's really generating a lot of buzz is the development of a chlamydia vaccine. Can you imagine a world where we could prevent this infection altogether?
That would be incredible, a total game changer for public health. Where are we at with the vaccine research? How close are we to actually having one?
Well, there are several very promising vaccine candidates in various stages of development right now. Some of them focus on training the body's immune system to create antibodies that block chlamydia from attaching to and infecting cells.
So basically, like teaching our bodies to fight it off before it even starts.
Exactly.
Yeah.
It's like giving your immune system a set of blueprints so it knows what to look for and how to neutralize the threat. Other vaccine approaches aim to trigger a cellular immune response where specialized cells target and destroy infected cells.
Wow, that's fascinating. It's like a two-pronged attack, preventing it from taking hold and also eliminating cells that do get infected.
That's a great way to put it. And while there are still challenges to overcome in terms of safety, efficacy, and distribution, the progress is really encouraging.
It definitely gives me hope for the future. But in the meantime, while we're waiting for a vaccine, are there any other new prevention strategies being explored?
Absolutely.
Hmm.
One approach that's gaining a lot of attention is called doxycycline post-exposure prophylaxis, or doxy-PP for short.
Doxy-pip. That sounds interesting. What's that all about?
It involves taking a dose of doxycycline, the antibiotic we discussed earlier, within 72 hours of potential exposure to chlamydia.
So kind of like emergency contraception, but for chlamydia.
That's a great analogy. Early studies suggest that doxy-PP could significantly reduce the risk of infection after a sexual encounter. It's not a substitute for regular screening or safer sex practices, of course, but it could be a valuable tool for those at higher risk.
That's really amazing. It could really make a difference. But I imagine it's important for people to talk to their doctor to see if doxy-PP is right for them, right?
Absolutely. It's essential to have that conversation to determine if it's appropriate for an individual situation and risk factors.
It sounds like we're on the cusp of some really significant advancements in chlamydia prevention. What about in terms of diagnosis and treatment? Are there any new developments there?
Definitely, researchers are working on new diagnostic tools like rapid point-of-care tests that can give you results within minutes, right in the doctor's office or even at home.
That would be fantastic. No more waiting for days to get your lab results.
It's exactly. Faster results mean faster treatment and partner notification, which helps curb the spread. There's also a lot of research going into new antibiotic regimens that are shorter, more effective, and have fewer side effects.
I imagine that would be welcomed by a lot of people. Some of the current treatment options can be a bit challenging, especially if you experience side effects.
You're right, and that's why this research is so important. And lastly, there's a growing movement towards more personalized approaches to chlamydia management. That means tailoring treatment and prevention to an individual's risk factors and needs.
That makes a lot of sense. It's not one size fits all.
Exactly.
It sounds like we're moving towards a more proactive, personalized, and empowering approach to chlamydia care.
I couldn't agree more.
Yeah.
And with all the amazing research and innovation happening, we're getting closer to a future where chlamydia is no longer a major threat to sexual and reproductive health.
Well, that's a very hopeful note to end on. I always love learning about new advancements in healthcare, and it's clear there's a lot going on with chlamydia research and prevention. As we wrap up this deep dive, I just want to say that knowledge is power when it comes to chlamydia and any health concern, really. We've learned that chlamydia is much more common than many people realize, and it's often silent, which makes regular screening so important. We also talked about effective treatments, the crucial role of partner notification, and the exciting new developments on the horizon. We hope this deep dive has given you the information and confidence to take control of your sexual health. And if you have any questions or concerns, don't hesitate to talk to your doctor. They are there to support you and provide personalized guidance. Thank you so much for joining us on this deep dive into chlamydia. We hope you found it informative and empowering. Remember, stay curious, stay informed, and stay healthy.